Right now, almost 86,000 Americans are in the hospital with COVID-19. That is a new record, according to the COVID Tracking Project. In the Northeast, Massachusetts and New York are both scrambling to reopen temporary field hospitals that haven't been used since the spring. NBC News correspondent Antonia Hilton is outside one of those facilities in Worcester, Mass.
Hey, Allison. So this is the DCU Center, but now it's UMass Memorial's field hospital site. And starting December 6th, they are going to start bringing in overflow patients from around the state. Right here, patients are going to come around the corner here down this road and be brought right through into this garage. So this has basically gone from being a landing spot, a garage, and turned into a makeshift emergency room. Many of the patients here are people who are going to end up needing significant oxygen support. So around this corner here, I want to show you something. Right here, you can see a large oxygen tank that the team has drilled right into the side of this convention center. That has frozen liquid oxygen in it that will be available to patients starting on December 6th. People here are working 12-hour shifts, and many of the healthcare workers feel more prepared than they did during the first wave, but they're also starting to feel exhausted. Listen to this conversation I had with the CEO of UMass Memorial, Dr. Eric Dixon.
I think for the people that are caring for patients now in the second surge here in Massachusetts, it's incredibly frustrating. By and large, healthcare workers have played by the rules. They've worn their masks. They've social distanced. But yet, because everyone didn't do that, they are now put in a situation where they're getting exposed to this virus again, which could get them exposing family members. And it is frustrating. It didn't have to happen.
Dixon's team says that on December 6th, they'll be ready to have about 25 patients here, but they are going to be staffing up and recruiting nurses and team members from around the country so that eventually they'll have capacity for up to 215 patients. Although certainly healthcare professionals here really hope that Massachusetts never gets to that point.
North Dakota has the highest daily COVID mortality rate in the world, according to the Federation of American Scientists. Last week, the U.S. Air Force sent its nurses to help hospitals in the state. Today, those nurses are reporting for duty. NBC News correspondent Gabe Gutierrez has the story.
Allison, we're here inside the event center in Bismarck, North Dakota, where a massive drive-through testing site just wrapped up. They had about 1,000 tests here. It took them about 2-3 hours to go through all of them. Now, the people who took those tests will have to wait 5 to 7 days to get the results. The public health director here says that's because the labs here in the state are simply overwhelmed, so they need to send these tests out of state in order to get those results. But Allison, this is just one of the many signs that the situation is growing more dire here in North Dakota. It is a state that has seen a dramatic rise in cases, a dramatic rise in deaths as well. And today is the first day that several Air Force nurses, dozens of them, will be reporting to duty, for duty at several hospitals throughout the state. They'll be working in COVID ICUs. Many of these are critical care nurses that are being brought on to relieve some of the pressure on these hospital systems who are dealing with massive staff shortages here. Now, this is something that we have seen over the last several weeks escalate in North Dakota. Critics of the Republican governor say that the mask mandate that the governor announced earlier this month was simply too little too late. The public health director here in Bismarck says that part of the reason for this increase in cases is because enough people haven't adhered to those public health guidelines. Now, we spoke to some of the nurses that are reporting for duty today here in North Dakota. Here's some of what they had to say.
I'm just proud that I get to be a part of this whole of America effort in providing world-class medical care to all of these patients, whether they're civilian, whether they're military at the hospital in Eglin. I'm proud to serve wherever I can be an asset.
You never get used to it, but this is a very worthwhile endeavor. And again, we're proud to be here to support our brothers and sisters in North Dakota in this fight.
Again, about 60 Air Force nurses are being deployed here to North Dakota to help relieve the surge in cases and the pressures facing the hospital systems here. Air Force nurses have been previously deployed to California and Texas, but this deployment to North Dakota is expected to last at least a month. Allison.
We said it yesterday, we will say it today, and we will probably say it again tomorrow. The coronavirus pandemic is spreading in nearly every single state in the U.S. And if we keep going at this rate, we could hit 20 million coronavirus cases in the U.S. by Inauguration Day. That's according to a forecast from Washington University in St. Louis. That is January 20th, less than 2 months from now. Columbia University Medical Center emergency physician, Dr. Sion Faroux joins me now. Dr. Faroux, what do we need to do in this country to stop our COVID cases from doubling in 2 months? Or is this something that is just inevitable?
I mean, the short answer is we can try to bend the curve by really decreasing the urge to return to normalcy. As the model predicted, we're seeing that by January 31st, if people go back to 100% normalcy, it will reach up to 25 million. But if we try to reduce that, at least with some of the restrictions, and go to at least 50% or less normalcy, then we can actually keep the numbers less than 15 million by the end of January. And I think this is something that we've been preaching for the past 11 months, which is something that you guys have been trying to do. Everyone is trying to ensure what we've been preaching, and people actually do implement that, the washing their hands, avoiding the mass gatherings. And also now we have more testing available, and get tested and know your status and stay at home if you're sick. And hopefully when the vaccine becomes available in the next few months and people will get vaccinated, and this is some of the things that we can do to decrease the spread of the disease.
Dr. Faroux, over the last 2 weeks, there was a 28% increase in child COVID cases, according to the American Academy of Pediatrics. They also say that kids now make up 11% of COVID cases. We know kids can be affected differently than adults. What should parents be looking out for in their own children as these numbers continue to grow?
Yeah, what we know so far is, kids do not get as severely ill as adults, and it's very rare for that to happen. But we're seeing some death and also severe illness in kids. But most of the symptoms are very similar, like what we've seen in adults, which are the cough, the congestion, the fever, and of course, infants can't tell you they have sore throat. But of course, for infants under the age of especially 1, you have to look for signs of poor feeding and poor appetite, decrease in the number of the diapers, and those are some of the things that you can look at. But of course, I think most parents could tell when there's something that's off with their kids, and if available, to get them tested.
Obviously, small children can't isolate if they have COVID. What advice do you have for parents whose kids test positive? How can they care for their little ones and also protect the rest of the family?
So usually you want to try to limit the number of people providing the care, if there's one parent for the sick child, and isolate with that child if possible, and use separate bathroom or also feeding area. And other things, in addition to mask and washing hands, something that we recommend is face shields, because when an infant is coughing or when a child is coughing, they might not be able to cover their mouth or wear their mask. So you want to also you also want to avoid the inoculation of the virus to the eye. So that's something that we recommend for most people that are taking care of infants or children.
Let's talk Thanksgiving now, just a couple of days away. The CDC warned people not to travel or gather, but we know it's happening. The TSA has already screened millions of holiday travelers. If people don't follow medical advice, what do you expect to see in your ER and in ERs across the country over the next 2 to 3 weeks?
Yeah, unfortunately, the numbers over this past weekend of the number of people traveling, it's not only just through airplanes, but you've seen at train stations and at the airports, just people that are in the crowded areas. Unfortunately, even when the middle seat is open, that does not really protect you. We expect the numbers to, unfortunately, grow exponentially. And we've seen in the past few days, highest record number of cases in the U.S. in the past few days. And if people, are not going to listen to the advice from the CDC, especially with not only Thanksgiving, but with the upcoming holidays like Christmas and New Year's, and there's more traveling, we expect the numbers in January to be very grim, and also our hospitals, our emergency departments crowded, and like we've seen in some places, to continue to have the shortage of ICUs and hospitals.
For people who are getting on a plane, a train, or a bus, how can they stay safe? Is one type of mask better than another? Should they wear gloves? What would you recommend? What are things they can do to minimize their risk if they have to travel?
Some people, at least as when they travel, if they could have the N95 or the K95, we know that mostly the spread that's happening is not inside the airplane, but surely what happens at the airports. And I know most airlines are trying to open the middle seats so that way it won't be crowded. But people just have to be very cautious when whenever they go to the toilets, just making sure that they sanitize or wash their hands very thoroughly. And also if they have some testing helps before they travel or after they travel, but that just tells you that you don't have the disease at the time. But if you have gathering and living, like I know mass gatherings and stuff people are avoiding, but even living room gatherings of more than 10 people, that we've seen the spread happening in places like in New York and some major cities. So if you really can, just avoiding large gatherings, but at the same time when they travel, to always have their mask on, wash their hands, be very vigilant of their surrounding. As we say, 6 feet apart or 6 feet under, it's very, very important that people keep their social distance and the physical distance so they won't spread the disease.
Oh, I have been covering COVID for months now, and that is the first time I've heard that one, and it definitely gets the message across. Dr. Fu, thank you. Your first time on News Now. It's such a pleasure to have you. We really appreciate it.
Thank you.
Hey, NBC News fans, thanks for checking out our YouTube channel. Subscribe by clicking on that button down here and click on any of the videos over here to watch the latest interviews, show highlights, and digital exclusives. Thanks for watching.